All right, good afternoon and welcome back to HealthLeaders, the Winning Edge program, and thank you for waiting. We have bypassed our technical difficulties here. We will have a program that will take you to the top of the next hour. This is a weekly series of webinars we have touching on the topics and strategies that you need to know most. My name is Eric Wicklund. I'm the Senior Editor of Innovation and Technology here at HealthLeaders, and I'm going to be the moderator for today's session. Today's webinar is titled The Winning Edge for Solving the Data Dilemma. Thank you to our audience for joining us today, and thank you to our participants, who I will introduce shortly. Before we get started, I've got some few very quick things to get through, housekeeping details. Note that an on-demand version of this program will be available on our YouTube channel on Friday, and it can be accessed through our website, healthleadersmedia.com. To ensure that you see the content, please maximize your event window. Be sure to adjust your computer volume settings for and/or PC speakers for optimal sound quality. Next, you will find a resources list for today's webinar in the upper right corner of your screen. Here we've listed the webinar slide deck and some additional materials for you to download, along with a registration link for future The Winning Edge events. We usually have a Winning Edge each week. At the bottom of the console are multiple widgets you can use to submit a question, and we will try to have a Q&A excuse me, at the tail end of this session. I know it's a little truncated today, but I will be looking at questions coming in from the audience. To submit a question, click on that Q&A widget. It may be open already and appear on the left side of your screen. You can submit questions at any time. However, we won't get to answer them until towards the end of the show. And finally, there's a good one. Should you experience any technical difficulties during today's program and need assistance, please click on the Help widget, which has a question mark icon and covers common technical issues. And with that, let's get into the discussion. It's my pleasure to introduce our two panelists for today's discussion. Roopa Foulger, Vice President of Digital and Innovation Development for OSF HealthCare. I need to slow down a little bit here. And Sarah Pletcher, Chief Digital Health Officer and System VP and Executive Medical Director of Innovation for Houston Methodist. Thank you both for weathering the storm a little bit and joining us today. And with that, I want to get right into the discussion. And actually, what I'm going to do is bypass the first one because I'm going to include that in the second one. I'm going to ask you both, as we start here, to introduce yourselves a little bit, and then talk for a few minutes about how your health system stores and manages data. And I'm going to start with Roopa.
Sure. So I have a software and data engineering background. I'm passionate about utilizing data for automation and enhancing user experiences. As VP of Digital and Innovation Development at OSF HealthCare, I'm focused on building innovative digital products with leveraging data as a backbone on what we call as Horizon 2 and Horizon 3 products. And one of the things that I've done in the organization is help bring together more than 30 sources and build out over 200 features that enable better decision-making for the organization. So diving into the question itself, right? So as far as the data management and data storage is not one size fits all. And we certainly distinguish between different types of data, whether it's transactional data that is from your typical EHR or operational systems, scheduling systems, and things like that, or your backup and archival systems. And finally, analytics-based platforms, which is a big part of what I had been working on in my organization. So at OSF, of course, we serve all these different types of data needs. And we focus mainly on a lot on governance and standards, as well as having FHIR, HL7, SNOMED, and ensuring interoperability and quality of the data. It's not easy. It's very challenging, and it's with the 4 V's that we say in data, which is velocity, variety, veracity, and volume. It's just been crazy and how much we have to manage and work with. And of course, there are newer methodologies, newer techniques. But bottom line, it's all about people and processes that come together that help manage all of these different sources of data, different types of data. So without the people and the process, it's not as easy as to manage just with the speed that we have to deal with all of this.
Okay. Sarah.
Hi there, I'm Sarah Pletcher. I'm a physician, a surgeon by training, and I'm the Chief Digital Health Officer at Houston Methodist. So my role over the last 15, 20 years has been really bringing innovative programs forward to scale. So a lot of virtual monitoring, centralizing automation, now AI, wearables, et cetera. So unlike my very esteemed colleague on this call who will carry us, I hope, I'm not in a data role. I don't store or manage data. I'm in, if anything, a downstream customer reliant on data as an essential ingredient in so many of my programs and projects. So we'll both have a different vantage point. I think Roopa did a great job outlining how health systems have to think about storing and manage data. I think the thing I would add is that we can't just care about how we, the health system, store and manage the data, but we really have to be involved in how our vendor partners store and manage data, how our employees store and manage data as they're communicating in everyday life, doing their jobs, how contractors have access to data, supply chain, insurers, and our patients, right? Like nowadays, a patient can click on agree, and integrate and have data exchange right through the EMR. So it's become a very complicated world, and no longer can you just focus on your own organization, but really, everywhere the light touches. So our health system has several areas of expertise, ranging from a center for research data and outcomes, our owners over the business and operational data, quality, the data governance committee. We have a chief AI officer, leadership in IT around security. So there really need to be a lot of chiefs around the fire to try to keep the tightest security and privacy, but also to allow interoperability and usability of the data in this new dynamic landscape that we find ourselves in.
Thank you. Yeah, and I think it's important to note that we need different viewpoints on this.
Exactly. Yeah.
Right.
Data is often described as the backbone of healthcare, and
Right.
it certainly that's what you use. And so it's important to place that in perspective. I mean, with innovation, with AI, with new technologies, we are using data more than data. We are collecting using more data than we have ever had before. So I'm interested in knowing as we move forward, we're going to approach this from an innovation angle as well. As I said, AI, virtual care, remote patient monitoring, digital health. Are there protocols in place for some of this new data coming in, gathering and using unstructured data especially? Is it a more difficult process now to gather and manage that data? And I'm going to start with you on this one, Sarah.
Yeah, I mean, I think it's a little bit of a paradox. So there's massively more volume and complexity. So in that respect, it's wildly more difficult. On the other hand, the same tools like AI that are making it more complex are also tools helping us manage and wrangle and organize and create usability. So a lot of the protocols that we have in place are good starting point frameworks, but need to be evolved, whether it's our IRB protocols for data use and research, or data use agreements we have with vendors, our privacy security standards, our IT standards. You often have to take what was the philosophy of the original protocol and keep that in place, but to evolve and refresh the language to better capture the modern landscape. So I think my answer is it's a lot more higher volume and high complexity and dynamic, but yet at the same time, we have more tools to contend with it. So bit of a balance. I'm curious how Roopa sees it.
Well, certainly, Roopa.
Yeah, I would agree with Dr. Fletcher had said. It is. I mean, we are inundated with just huge variety and volume. At the same time, as she said, there are methodologies or protocols. And AI is also not only from decision making, it's also helping us wrangle some of this data and manage some of this data too. And besides protocols that we follow on the research side, much like what Dr. Fletcher covered about IRB protocols or things that we have to put in place based on agreements that we might have, whether it's payer-based agreements or some of our vendors or partners. So a lot of it is not only from protocols, from a security protocols, from a technology interoperability, but also more protocols that are based on compliance and based on agreements that we might have in place. We of course, as I said, AI is also frameworks that help with some of the AI aspects is also something that that's getting used. An important part is also making sure that we can tag this data, we understand the metadata. I mean, there's a whole science behind it, just from a technology standpoint, determining the readiness, the compliance, which I already talked about, and then alignment of the data and the access protocols around, people that want to use the data and the purposes that they would use for, as well as we are a Catholic-based health system, so we are governed by ERDs, Catholic-based ERDs, and that also guides us in how we would gather the data and be using a lot of this unstructured or structured data.
Yeah. Okay. Well, we've talked a little, and I'm going to go a little bit off script here. We talked a little bit about strategies and about how you're bringing different departments into the conversation now. With AI becoming so much a part of this conversation, has it changed who you're bringing into these conversations? Are you bringing more people? Are there more departments that now have a say in data management? Roopa, I'll start with you.
Absolutely, yes. It's gotten more complicated with more and more, as Dr. Fletcher said, devices, IoTs, all of the data, omics, right? Genomics data and all of that coming through. Patient privacy is so important. So we have to bring, different, players at the table. And we have we have a group called Data Stewardship Work Group, and we have different escalation within it based on, how complex it is, or if it's, we also don't want to just throttle the system in putting in more and more counsels and using the data. So we have a means and levels and how it gets escalated, so that we are being careful in how the protocols are being put in place and how the data is being used. So, traditionally, it had been, your technical or your compliance and your legal, but it's now expanded based on the use case. We bring in, external people that might have the external counsel if needed, if it's something that's complex, or we might bring in business stakeholders, whether it's a different service line leadership or team that might be using the data, how they might be using the data, and so based on the use case is how we've now started evolving and who needs to be at the table to help manage some of this.
Okay. Now, Sarah, same question, put a little differently. How does it change the conversations you have with different departments about their data management and data use, especially with these new innovative ideas coming in?
I mean, I would agree that I think, kind of now that everyone is trying to get their kayaks onto the whitewater river that is data flow, you have to bring more people into the conversation. I think I found it helpful to try to simplify before then bringing people forward into complexity. So, as an example, to take 25 pages of legal contract around data and to kind of dumb it down to, let's just talk about how we're going to share data, how data is going to be used, how data is going to be stored, how data is going to flow from points A to B to C to D to E, whether data will be sold, and then to also talk about, if you will, derivatives from data. So if we share data and learnings or algorithms derived from that data and the original data is returned back, how do we handle those those derivatives, both from a security perspective, from a IP perspective. So again, I think sometimes when you have all these new stakeholders around the table, it can help to really put things into layman's terms and align on the big picture before you start getting into complexity, because just the time to try to get everyone oriented with jargon and detail can be a challenge.
Yes. Okay. Hey, here's a topical question right here, and I'm gonna start with you, Sarah, on this, and I'm gonna simplify this a little bit too. How has AI?
I need like third grade reading level, Eric. So keep it basic for us.
No, I was just gonna say, how has AI affected data management and governance? How has it changed it? Or, we've talked about it being more complex, but at the same time, Roopa, I think you mentioned too, it's AI is designed to make data more simple for us. So how is it changing things?
Yeah, I mean, I think it's kind of some of the same themes. AI tools are getting their hands on more data and bringing them all forward. So again, there's much more complexity and integration, yet the tools themselves allow us to manage data differently. On the governance front, again, I think we have had to specifically establish an AI governance committee, recognizing the complexity in this, to try to kind of help stakeholders understand what they need to keep track of. So even using AI to organize the process and the spreadsheet of all of the different companies we've reviewed. So there's an irony there that the very thing that is creating a lot more work is also there as a companion to help us do that work. So yeah, I think it's an overall positive benefit, but it's definitely a volume and complexity management development opportunity.
Very good. Okay. Roopa, same question. Now, how has AI changed what you do for data management?
I think it's with just the complexity. I think we have to adopt some of the AI tools, just because you can't add more and more staff. You have to become smarter in how you can enable that. And also Dr. Fletcher talked about derivatives of data, right? So in healthcare, and of course in any other industry, it's the governance around data. It's the semantic, which also involves, besides the technical, the security, the protocols, right? The semantic meaning of the data, because where the data was acted on or how the data was inputted has a meaning depending on where it is in the workflow, in the clinical workflow. It has a whole different meaning, right? And then it impacts the derivative of the data. So I think that's why governance becomes very, very critical, the data governance. And I'm very passionate about it as someone who's been on the other end, and the meaning of the data can totally change based on the context and the process, besides your SNOMEDs and vocabularies and all of that. And especially as we get more and more into clinical, operational data, which is being used for a lot of the AI tools. So as far as the AI tools itself that is affecting data management, there are practices in terms of around data operations. Practices which really managing the data life cycle through automation, through monitoring, and through continuous improvement in terms of the data quality checks and seeing if there's any data anomalies. So there are a lot of AI tools that are coming out in the market that can be used, as well as AI helps with the fluidity that we can expect with the data in terms of integration, in terms of governance framework, in terms of bias monitoring, in terms of also model validation, because the data becomes the fuel, the gas for a lot of the AI models. It's for use for decision support. So enabling all of those, I think there are tools that are coming out because it's getting recognized that you can't humanly manage this and you need to have AI tools. And also being able to, help with some of the governance stuff in terms of automatically monitoring policies, and also providing an oversight on the AI models that's leveraging the data, right, for decision support, as well as the data evolves over time.
Yes. Okay. Great. This kind of dovetails into the next question too. Is we've talked a lot about the challenges of managing data. What are your key challenges to making sure that data is safe and secure? And you mentioned hallucinations with AI and data drift and all on that. What protocols do you have in place for making sure that the data you use is safe and reliable? Roopa, I'm going to start with you on this one.
So, you talked about AI drift, this model drift, that's just, and then drift in the data because of semantic and process changes. It's one of those things where it's constantly changing and evolving. So the best way, besides having tools, it's really to put people and processes in place to start monitoring and managing those. Besides that, I do want to also bring up a key point that Sarah brought in, which is about your different vendors, right? SaaS-based vendors that are on the cloud. There are so many partners that we are now collaborating with from a digital standpoint to enable digital health. I think even, how do we make sure that, understanding their protocols and making sure that they are vigilant, they are putting in place measures to be able to keep the data safe and secure, and so that even derivative data that the vendors might have is also not getting inadvertently used for some other purposes than what we have an agreement on. So I think there are so many layers in making sure that we're keeping the data safe and secure beside your typical cybersecurity data, how the data gets stored, how the data gets retrieved. I think also collaborating with our vendors and constantly, having some type of a process, whether it's automated or whether it's people-oriented, and monitoring those things, and really moving into a shared responsibility model, whether it's vendor, a cloud, or an on-prem, I think are important. At the same time, can complicate accountability. What is really important, I cannot stress more, it's more the people. At the end, it's the people that actually make sure that we are safe and our data is secure. So training and staff training constantly is important, and making them aware of changes, whether it's agreements or whether it's policies, I think are some things to think about, and things that we've also implemented to make sure that we are on top of making sure that we are accountable with the data that we are taking care of.
Yeah, and certainly with the use of generative AI, it involves continuous monitoring, which is probably something you haven't had to deal with before with vendors. It's a different playing field now. Sarah, same question. What are those new challenges that you face in making sure that your data is safe and secure?
Well, I think since Roopa did a great job talking about it from one dimension, maybe I'll flip it to kind of more the safety and reliability of the data. I think one of the things, and she touched on the importance of education. I agree, it's needed really for everybody. And I don't know that the average person or even health system employee understands the degree to which our landscape is so Internet of Thingsified, right? Like every single thing in that hospital room, from the bed to the IV pole to the ID bracelet to the TV, is collecting and transmitting data to help those manufacturers make a better product, right? Like if it's the wheel on the hospital bed, the company that makes that wheel wants to make the best hospital bed wheel in the industry. So they're collecting all sorts of data about the patient movement, the staff movement. So I think understanding the pervasiveness of data collection in our environment, and then to understand all the many opportunities, and I touched on this earlier, where the patient themselves or the health system team members are prompted to sign away permissions, right? Like scan this QR code when you're picking up your medication at the pharmacy, and to get the thing to work so you can order it ahead and pick it up at the drive-through, you're clicking through where you've just given away permission to use your data in any which way 4 different companies want. And so I think kind of we have to hold ourselves accountable, as Roopa pointed out, but we also all have to be aware of how much data exchange is happening and how little control we sometimes have over how those permissions are being given away. And so I think the shared governance is really a shared responsibility to try to educate and make the best decisions we can, but recognize the environment that we're in.
Yeah, that's a good point. Excellent point, yeah.
Mm-hmm. Yeah, and as you say, it's, we are in an Internet of Things now, and that certainly has changed. That the hospital room of the future, which we talk about a lot, is an interconnected room. Everything in there is connected. Everything there is collecting data. You mentioned the hospital bed. You've got some smart beds now that can catch a lot of different data points about patients.
Yeah.
We are eventually going to see that move to the home as well, and that certainly will affect healthcare as well. Now, with that in mind, we are approaching this from 2 different ways with data. There is data that has clinical value that your doctors and nurses will use for patient care. Actually, there's more than 2 ways, but this question focuses on 2. There is also data that your rev cycle teams, your CFOs need, certainly to determine the financial value of a medical process or so on. How do you, when you're getting this data come in, how do you separate it, or do you separate it? Is it shunted off to the rev cycle team or to the clinical team, depending upon its value? Sarah, I'm going to start with you on this one.
Yeah, and it's a little bit of a cop-out answer. I think the reality is it's very difficult to parse whether something has no clinical value or not, and almost the same with financials. So there's a little bit of, at least from the health system vantage point, we put the umbrella of protection and privacy and IT security standards over all of it. And then, we do our best to put tools in place to capture and curate and make actionable data of clinical value. In terms of the financial value, I think each health system has to make decisions for themselves on whether they are willing to see data as a commodity. There's ways to do that are compliant and appropriate. Some health systems, ours is one, we've just taken the position that we will not sell data. So again, I think that there's some decision making that every health system needs to do for itself. But I think, again, in this modern data era, it would be very difficult to know whether something has clinical value or financial value or not. We're getting unprecedented information. I'll give an example. We use a wearable patch on every patient, every hospital room. It's collecting minute level data across a zillion different parameters. We don't yet know what every piece of accelerometer data about that patient is going to tell us in terms of predicting, personalizing, delivering precision therapeutics. So we have to treat all of it as potentially having value in setting up protocols. So, again, just from my lens downstream, I treat all of it as valuable, and we learn and progress as we go. And, Roopa may have a better rubric for organizing value than I do. I'm further downstream.
No, but that's a good example of, and certainly we're seeing this in AI now, ambient AI tools that not only capture the doctor-patient conversation, but also code it or enable it to be coded. Now with remote patient monitoring, you're getting data from wearables and such. Does the rev cycle team or the CFO, do they come into this conversation? Do they look at this and say, there may be some value here in terms of what we're doing for coding or billing? Okay, Roopa, I'll ask that question of you as well.
Yeah, I think Dr. Pletcher definitely, well said in terms of, how do you assess value for clinical and financial value on data. In terms of your question around the rev cycle or CFO, there's just a lot of data coming through. Of course, we take and care for them and store them appropriately, making sure that it's the security and compliance needs being met. What we do is it's some of this data, it's not immediate that you can get a value on. Some of them is more you can you're bringing in subject matter experts to the table, to probably just quickly review the data, maybe doing pilots in terms of discovery process helps us validate how much of value this data is generating from a rev cycle process or from a CFO lens, right? But most of the time it really is around the clinical care, which is what impacting the financial value, whether it's reduced variation in care, whether it's better outcomes, whether it's improved patient experience. It always starts there, right? Operational efficiency, whether it's reduced manual process, whether it's optimized reimbursement. That's what then leads into some type of value for finance. So what we try to do is go through a discovery process, bring people to the table, see what is the value we can quickly generate. Some of it might not be a quick, some of it might take us some time because there's so much quality issues to deal with the data. So that's just another dimension besides what Dr. Pletcher said in terms of how you could assess value that the data can provide.
Yeah.
And I was just going to follow up on, a couple examples like AI scribe softwares, right? They're listening to these patient encounters, and it offers us value in many respects. Eric, you touched on coding and billing. Yes, by having a capture of the whole encounter with the patient, we can ensure that we didn't miss elements of the discussion as should be reflected in coding, or the opposite. It helps us prevent and be more accurate in our coding, but it also brings data forward in real time as the provider is engaging with the patient based on what's being discussed, to bring data forward to say, hey, this patient has tried these 2 medications in the past. You might want to explore with them opportunities to try this 3rd medication, to sort of better target capturing a discussion around what's needed for the patient. So I think, all the AI sensors, cameras, listening, we're just scratching the tip of the iceberg in terms of how we're going to leverage that data clinically and financially. So I think it kind of goes back to us aligning on the idea that we're putting that value umbrella over all of it, as we learn more, where those next frontier opportunities are going to be.
Yes, definitely. And with the idea that we're 10 or 15 minutes left in the hour, I want to turn this around a little bit. Sarah, you had certainly mentioned this before, the idea that patients can use their data now. Patients are requesting access to their data. It is prompting health systems and hospitals to think more along the lines of patient-centered care, where you're working with the patient, where you're giving the patient access to information that will improve their care management, their health and wellness. Are the rules different for allowing patients to access and use the data that you have? And I'm thinking more along the lines of the patient portal, data that you're collecting on them. How do you manage data so that your patients can use it? Sarah, you first on this one.
Frankly, it's tough. I think Epic, we're an Epic shop. Epic is wonderful. We have MyChart. They have been very forward in thinking of how to make data and results available to the patient, and more tools being deployed every minute in terms of making it easier to navigate and understand that data. That being said, there's still a long way to go to help patients really understand the insights from their data. And that's where you see, again, and it's good and bad, right? They buy a watch, they buy a scale, they, try a new fitness regimen, and every app they download, they're clicking agree to give away permissions in order to see that data with insight. And so on the one hand, great that there's all these tools. On the other hand, it's complexity, and you have to assess the value of those tools and what are they doing with your data. But I think a lot of us, myself included, I buy the smart ring. I just want it to work and show me a little dashboard. And so I'm right there signing my privacy away because I want to just be told when I need to sleep more. So I think that is the landscape, is patients want actionable insights, not just data. And so how we offer up that, that interpretation is tricky. Sometimes they really just need a conversation with their doctor, and us trying to explain the data in the absence of that relationship is more risk than benefit.
Mm-hmm. I've had a couple conversations this past week in our AI and clinical care mastermind where there was some concern among clinicians that patients may be getting too much data. And they may not know what to do with it. You have the idea of somebody walking into their doctor's office with a whole list of questions that about their data that might be a little bit more than a doctor can handle, or might take away from the value of that conversation. There is a concern there going, especially with AI being mixed into the equation. Roopa, same question. How do you manage data for patient access and use?
Yeah, I mean, it's, I think we are all figuring things out, as, Dr. Fletcher said. It's just so much data coming through. And you, Eric, you had mentioned about patient first portals. Dr. Fletcher said about MyChart. Of course, there are great ways how patients can have access to seeing their visit summaries or results and billing information. What we are also looking at is how we can translate some of the complex clinical data into plain language or visualization. So we have human-centered designers or user experience designers that we collaborate with some of the digital tools that we are deploying or building to help navigate some of that complexity. As well as, in terms of managing data for patients, it's also the federal government is now pushing in more measures around digital identity and security. So you make it easier for patients to access their data, right? Not requiring multiple logins and authentication. Also the newer policies around information blocking, of course, is going to make more information available, but really how do you translate that into less complex clinical, into plain language? I think that's a big thing that a lot of healthcare systems providers are working on. I also want to mention that this is also a great way to engage patients in their care, and not a clinician as a patient I'm speaking, right? So some of the digital tools that we've deployed also help, whether it's through the portals, right? Patient-reported outcomes bring information from the patient, is so that patients are contributors rather than passive recipients, which also gives us more idea in how we could more digitally engage with them. And I think it really is a balancing act in terms of how do you create openness, privacy, and safety. At the same time, how do you address digital literacy gaps so all patients, not just the tech-savvy ones, can benefit?
Yes. Yeah. And the idea now that data always has had value, but now that we have so much of this data, it can be used for good, for bad. We have to consider healthcare as the gatekeeper. This data has value in different places. You need to determine, as a healthcare institution, where that data goes and how you can control it so that it's not used improperly, inadequately, or whatever. So that means talking to vendors. That means talking to patients. That means talking to your clinicians. What has surprised you maybe about where we are now with data management and governance? Is there something you didn't expect to see happen in this marketplace that you appreciate or you're worried about?
I could probably go first on this. Okay. I think COVID just was a game changer, right? So I didn't expect that. That was a huge game changer in how much digital tools that got deployed and got used, which is a good thing, I think, from a patient side, but also it just amped up and scaled up pretty fast in terms of how we needed to manage all this data, how we needed to secure. I think so that was something personally for me unexpected, which changed with COVID. So what was the follow-up question? Sorry, I was drawing a blank.
Yeah, I think you'd answered it. The idea that COVID came along and kind of changed our perception of data, of what we do with data. I'm going to ask that same question to Sarah. Is there, are you surprised at the way things are going? Are you worried or appreciative of how we're handling data now in healthcare?
It's a good question. I'm trying to think of something that's been really surprising or worrying more than just baseline surprise and worry. I think in general, I would say, and I've touched on it quite a bit, that, we in healthcare care and worry so much more about patients' data privacy than any patient I've ever met. I think that kind of continues to surprise, right? Like, the patient just wants to live their life as well as they can, feel as good as they can, have as much convenience and simplicity as they can. And that's kind of the trade-off they're making. And I think sometimes I'm surprised that we don't get out of our own way to deliver those experiences to patients. So I guess I'm surprised that there's still such an abyss between what patients want and the trade-offs they're willing to make for it and what we're delivering to them, again, in terms of a truly integrated, convenient experience because of our worries about their privacy.
I like that. We may be making things much more complicated than they need to be. Okay, we're less than 10 minutes left. I certainly welcome the audience to send in any questions at any time. You know the drill. Use the Q&A icon. I'm going to continue speaking here because I like the conversation we've been having today. And I want to kind of touch upon something I mentioned at the beginning as kind of a closing part of this conversation. The idea that healthcare is moving more and more out of the hospital and into the home. And of course, data collection, data assessment is going to go beyond what you're doing within the four walls of the hospital. And you're going to start talking about data gathered from the home or from wearables that the patient is wearing all the time. How do you see data management assessment changing as you start instituting, say, a hospital home program or an RPM program out of the home? Some of these new ideas, some of these new programs, how does that change how you gather and govern data? Sarah, I'm going to start with you on that one.
I think it's going to push us to evolve some of the legal regulatory reimbursement frameworks to recognize, again, more of the reality of how patients live and exist and want to collect data. As an example, in terms of RPM, when you're trying to deliver an RPM program, you're really limited in which data you can consider as part of care that you're billing for. You're limited to constraints on how many days the data must flow, so it keeps you from considering, well, gee, this patient may need lots of data collection multiple times per 24-hour period over 4 days. But again, these frameworks are a little archaic. So it's like, we need at least one data point for, X number of days. So again, I think kind of moving to a much more orchestrated, dynamic data immersive experience that's a combination of patient-reported, automated, maybe consumer device provided, as well as medical grade devices will get us further towards, again, a more realistic patient experience at home that is presided over by a medical team, but not limited only to devices the medical team has provided in a very stiff software environment.
Yeah. Certainly the regulatory and the reimbursement landscape makes it difficult, presents some challenges.
Right. I mean, agentic AI, right? Like these are agents that can have really rich, meaningful data intensive conversations with patients. I mean, that information about how a patient is feeling and doing and the questions and challenges they have, what kind of data is that. It's not data that came from a blood pressure cuff we sent them home with in a box, but I would argue that's a richer and more valuable source of information about how the patient is doing on a given day. So again, I think with these new technologies, we're going to have to kind of remember the intent of some of these frameworks, but evolve the framework to catch up to modern day.
Yes, and certainly as we talk about that smart home model, the information you're getting from the refrigerator, from the bed, from the toilet in the home, that's going to affect, that's going to help. It's going to impact medical care, and it's going to be interesting to see how that is gathered, assessed, and valued. Roopa, same question. It's where are we going with this, and how do you, as a healthcare executive, how does OSF HealthCare control and manage and govern that data that you're getting outside the hospital?
Yeah, I think Dr. Fletcher did a really good job, in terms of explaining. It's just with all the, home care, the hospital of the future, it's like data just generating everywhere. So it really is getting to, as she said, it's the orchestration part, right? Right now, all these different technologies are disconnected. They're all in their own, environments. And of course, we bring all this data together, and we'll, to your previous question about clinical and financial value, kind of reviewing them. But we really need to go to the next evolution where we integrate all these data points. Doesn't matter which vendor is putting together. It needs to go to the orchestration. And agentic AI, the backbone is data, right? Data signal, and the signal translates it into an agent to act on something. I think that's where we need to go and working with the vendors, working with the government in terms of creating these data pipelines and infrastructure so that they can talk to each other, integrate with each other, and orchestrate. I think that is what's going to generate a truly, truly differentiated experience, not only for our patients, but also for our providers, because they just get inundated with all of this information. And of course, you have AI tools that's converting them into information, but we need to orchestrate them and reduce the noise that all of this is generating, and really make them ambient in terms of even providing insights with that data.
Yeah, and certainly with your clinicians, you don't want to give them too much data. You want to give them the data that they need
at that time. Yeah,
and that can be tough. With all that data, this goes back to our understanding of how you can value that data. What a certain care provider needs in terms of data could be different from what another care provider needs, and
exactly.
Then you start mixing and matching and so on and so forth. It's going to be an interesting scenario going forward. I want to thank you, both of you again, for a wonderful conversation. I certainly could go on with this. There are a lot more questions I had that I couldn't get into this shortened time frame, but this does give us a good landscape for developing more of these programs in the future. Talk about data and to talk about some of these new innovations that are using and managing data. And certainly, my love of the idea that we're moving more care into the home. That's going to be a fun area to cover. So again, thank you very much for joining me today in this conversation. In closing out, please, I do need to note, I do want to note that our next Winning Edge program on October 7th, next week, will cover the Winning Edge for collaborating and building trust. A live clickable link will appear at the close of this program, taking you to the registration page for that event. Remember to follow along all week for continued coverage on solving the data dilemma. I will have a story on this posted tomorrow, and we will be posting the YouTube of this event on Friday. And to access those, please visit our website, healthleadersmedia.com. In closing, I want to thank Sarah and Roopa for an excellent conversation and for weathering the trials and tribulations of technology that we've had today. And finally, I want to thank you and to those in our audience for participating. We hope you enjoyed today's program and look forward to seeing you during our Winning Edge programs and other Health Leaders events as well. Thank you very much.